Hey everyone, welcome back to Factingly. Today we're diving deep into a topic that affects millions of people worldwide, but is often misunderstood: depression. We'll be exploring what depression really is, the signs to look out for, its causes, and most importantly, how to deal with it. So, if you or someone you know is struggling, stay tuned. This video might just be the resource you need. Let's start with the basics. What exactly is depression? Depression is more than just feeling sad or having a rough day. It's a serious mental health condition characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities once enjoyed. It affects how you think, feel, and handle daily activities. It's not something you can just snap out of or get over on your own. There are several types of depression, including major depressive disorder, persistent depressive disorder, bipolar disorder, and seasonal affective disorder. Each has its own set of symptoms and treatment approaches, but they all share common threads. Recognizing depression can be challenging because it varies from person to person. Here are some common signs and symptoms to watch for. Persistent sadness. Feeling sad or empty for most of the day, nearly every day. Loss of interest. A significant decrease in interest or pleasure in most activities you once enjoyed. Changes in sleep patterns. This could be sleeping too much or having trouble falling asleep. Appetite changes. Significant weight loss or gain, or changes in appetite. Fatigue, feeling exhausted or lacking energy even after sleeping. Difficulty concentrating, trouble focusing, making decisions, or remembering things. Feelings of worthlessness or guilt, excessive feelings of guilt or worthlessness. Thoughts of death or suicide, frequent thoughts of death, suicidal thoughts, or suicide attempts. If you or someone you know is experiencing any of these symptoms, it's important to seek help from a mental health professional. Depression is a real illness, and it's crucial to get the appropriate support. Depression doesn't have a single cause. It's typically the result of a combination of factors. Here are some potential causes. 1. Genetics. Family history can play a significant role. If you have a close family member with depression, you might be at a higher risk. 2. Biochemistry. Imbalances in brain chemicals like neurotransmitters, such as serotonin and dopamine, can contribute to depression. 3. Hormonal changes. Changes in hormones, such as those experienced during pregnancy or menopause, can trigger depression. 4. Trauma and stress. Life events like the loss of a loved one, trauma, or high levels of stress can contribute to depression. 5. Medical conditions. Chronic illnesses or other medical conditions can impact your mental health. 6. Substance abuse. Drug and alcohol use can both cause and exacerbate symptoms of depression. And 7. Personality factors. Low self-esteem, chronic pessimism, or a tendency to ruminate can increase susceptibility to depression. Dealing with depression is a multifaceted process that often involves a combination of strategies. Here are some effective ways to manage and cope with depression. Firstly, seek professional help. A mental health professional can provide diagnosis, therapy, and medication if needed. Types of therapy, like cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, can be very effective. Secondly, medication. Antidepressants can help correct chemical imbalances in the brain. Always consult with a healthcare provider for appropriate options and dosages. Thirdly, lifestyle changes. Regular physical activity can boost your mood and energy levels. Eating a balanced diet can have a positive impact on your mood. And prioritize getting enough quality sleep each night. Fourthly, build a support system. Surround yourself with supportive friends and family. Sometimes just talking about what you're going through can make a big difference. Fifthly, practice self-care. Engage in activities that make you feel good, whether it's a hobby, relaxation techniques, or simply taking time for yourself. Sixthly, mindfulness and meditation. Techniques like mindfulness and meditation can help manage stress and improve emotional well-being. Seventhly, set realistic goals. Break tasks into manageable steps and set small, achievable goals. This can help reduce feelings of overwhelm. And lastly, avoid substance abuse. Stay away from alcohol and drugs, which can worsen depression. It's important to seek help if you or someone you know is struggling with depression, especially if symptoms are severe or persistent. There are thoughts of self-harm or suicide, or the individual is unable to perform daily functions. Emergency help is available through hotlines and local mental health services. Reach out to a mental health professional to discuss the best course of action. Remember, depression is a serious but treatable condition. With the right support and resources, recovery is possible. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more content on mental health and well-being. If you or someone you know is struggling, don't hesitate to seek help. Thank you for watching and take care of yourselves and each other. Until next time, stay positive, stay healthy, and remember, you're not alone. See you in the next video.